The promenade, the people walking, the people talking. Facade, what do you want?
Harm reduction is the idea of accepting that people will do risky things and certain activities are risky, and then just trying our best to control that risk. So we do this all the time in daily life. For example, with driving a car, it's an inherently dangerous activity, but we control it as much as possible by having rules of the road, by legislating on how skilled people need to be to drive, and having safety specifications for vehicles. So when harm reduction is applied to health, it's the idea that you're respecting people's rights to make choices about what they do, and you're also, and to me, it's a compassionate thing to do, because we're promoting people's well-being regardless of where they are in terms of their behaviours or choices, and however much you agree with them. So this is a trigger warning. I will be discussing drug use and looking at drug paraphernalia during the next part of this video. Harm reduction is commonly applied to drug use, and I wanted to show you an example and talk you through it. So I was looking at crack cocaine smoking and devices used to smoke. So this is an example of an improvised crack cocaine pipe. You can see them quite commonly in car parks and places where people commonly use crack cocaine. It's made out of a drinks can. It's made of aluminium, as drinks cans are, which is harmful if you heat it up and inhale it. So you're causing extra harm on top of smoking crack cocaine. Then obviously aluminium conducts heat very well, so the chances of you burning yourself when using the pipe are higher. And if you have an open wound on your lips and you share your crack pipe, which is pretty common, then you're likely to pass on infections to other people. So that's another way in which you can cause harm. So the second one, this is actually illegal to give out to people who are going to use it to use drugs. So and it is a pipe made by a harm reduction company. It's made with heat resistant glass. So it's not going to burn you or shatter. It has a mouthpiece to protect the lips as much as possible, and then it has gauze to make sure that your drug is you're not going to inhale hot drug. And it's also likely going to come in a pack with things like antibacterial wipes. So it's not just about the equipment you're using, it's also the environment. So is this person using on their own, somewhere hidden away because they're worried about detection? Or are they using somewhere with friends? Are they people who are going to look out for this person if they're overly intoxicated, or if they're overdosing? Or are we looking at a supervised facility where there are medical staff on hand to detect if people are overdosing, to give medical advice and other interventions and support, and to encourage people to attend recovery services? And then the final thing you're thinking about today is the product. So what am I using? Is it something I've got from a dealer that I can't be sure what it is, or what's in it, if it is the drug I'm expecting, what concentration it is? So it's a gamble every time I take it. Or are we looking at a decriminalised model where people can provide testing of my drug so that I know what's in it, what concentration, so I know roughly how much to take in order to avoid an overdose? Or are we looking at a legal and regulated product? So something that I know exactly what's in it. Like if I go to buy a bottle of alcohol, I know that spirits contain a lot more alcohol. I know exactly the concentration, so I can have more control over how intoxicated I'm going to get. All of these services, having more harm reduction services available to people, is shown to increase take-up of recovery services. So why don't we take a more harm reduction based approach? So we've discussed things you can do, like giving out safer equipment, giving advice, having testing of drugs so you know what's in them, and also supervised consumption facilities. Well, as we know, drug use in the UK is criminalised, and that causes a certain amount of stigma. So people are ashamed of their drug use, and almost as a society we see drug use as like a moral failure or something wrong with your personality. And what that means is that people don't really want to seek out help because they're ashamed. And we as a society don't advocate for people because we look at it as a failure of people who are dependent on drug use. But in reality, people who use drugs in a dependent way, often it's because of past trauma. It's often to escape difficult emotions and difficult things in their lives that they don't have the capacity to cope with or support. So harm reduction then is more of a compassionate approach. So what I'd like to leave you with at the end of this video is to ask you a couple of questions so you can think about them. So it's what should our priorities be in terms of legislating and drug policy? Is it maximising health and well-being, having the lowest numbers of drug users, or is it to send a moral message? And what would it be like to have a compassionate and health-focused approach to drug policy?
There's too much pain, too much stress, nothing gained.